Health Organization's Director General, Tedros Ghebreyesus, in recent times spoke about the inequality in the distribution of COVID-19 vaccine across the world. In fact, he said that in developed countries and rich countries, so to speak, 1 in 4 Nigerians, or 1 in 4 citizens rather, have had access to the vaccines. Meanwhile, here in Africa, we have 1 in 500 people for most countries, especially the poor countries. This is the reality of the COVID-19 vaccine distribution across the world, and that will be the conversation on this episode of Development Issues. My name is Zainab Sanni, and I welcome you to this episode of Development Issues on Uminira TV. My guest is a health journalist and is also the community manager at the International Center for Journalists Global Reporting Forum, right? Yeah. His name is Mr. Paul Adepoju. Thank you for joining us on the Development Issues, Mr. Adepoju.
Yeah, thank you very much. I'm really glad to be here. Thanks for having me on this.
Okay. I made that introduction quite brief because I wanted you to do most of the talking. We just keep saying COVID-19 vaccine inequality, but it has huge implications for health. It has huge implications for economy. As someone who has done a lot of health stories and covered health globally, then also as someone who manages a community of health journalists, I want to believe, or I know for certain, that you understand the huge implications of these issues better. And what does it mean, especially as we consider the fact that the world is trying to get back on its feet, trying to recover from the economic challenges that came with the pandemic? What's the impact, or what's the implication of a COVID-19 vaccine inequality?
Yeah, thank you very much. And yeah, your introduction was really spot on. When you look at the global COVID-19 vaccine landscape, it's quite obvious that developing countries, especially countries that are tagged at the lower income, middle class countries, have been unequally disenfranchised. And the best way to look at how this is playing out is look at a country like the United States of America, which about a week or a half ago said now teenagers can now have access to COVID-19 vaccine. Any teenager that really wants it can have access to it. And because they've been able to vaccinate a lot of their citizens, they are even introducing new mandates that wearing a face mask is no longer
needed,
required.
Right?
But if you look at countries, many countries in Africa, yesterday I was looking at the breakdown of vaccine distribution. We have up to at least 4 countries in Africa that nobody in that country has been vaccinated.
Wow.
Countries like the Central African Republic and countries like Burundi, no single person have been vaccinated. Even those people that were classified as the top candidates for this vaccine, the frontline health workers and the aged individuals, yes, individuals that are above 50 years and those with underlying conditions, those people have not been vaccinated. And what is this? What does this mean? It means that these countries cannot even think about returning back to normal. Businesses cannot start resuming as they are supposed to be. Schools that are open will still be very cautious about what they do. And there is this weight that is actively on the necks of these individual countries. So until, like the World Organization's Director General usually says, until vaccine is available everywhere, there is no way that is safe. And it simply means that because vaccine inequality disenfranchises African countries and other countries of the world, even the countries that have already started vaccinating their citizens will still be at threat because countries in Africa, their citizens will still be traveling abroad and potentially transmitting this virus, and reimagining infections will continue to reemerge in these countries too.
We can see what is happening in India,
exactly,
where a stronger variant of the virus has taken over and is killing people at large. Now, my concern will be the question of some countries buying huge amounts of vaccines, even far more than they need or than all their population need, while other countries like, for example, Nigeria, look at how many vaccines you have bought, So looking at it from that angle, is it right, so to speak, or is it that the WHO cannot regulate how much vaccine each country is buying. I know it's a thing of the money, but this is a global pandemic, and there should be some sort of regulation on how vaccine is distributed, I want to believe.
In the real sense, I disagree with you. Any country that is forward-thinking, that is able to, and that has the wherewithal and the economic power to be able to afford these vaccines, nobody is stopping you from buying it. And we have to also appreciate one thing, that these countries that we are saying are stockpiling these vaccines, we're actually the first ones to fully commit resources, funds and money that drove the acceleration of the process that resulted in the emergence of these vaccines. Let me give you an instance. A country like the United States had this project that they called Operation WASP. And what that initiative did was to make billions of dollars available to these vaccine manufacturers to really guarantee them that even whatever happens to your vaccine candidate, we are going to be buying them from you. So that already gives them the confidence that, okay, whatever happens, we know that we are financially secure through these agreements. And another thing we have to understand is that every country is on its own. Look at what you mentioned. I was really impressed when you mentioned India. That India is actually the epicenter of the global pandemic now, because
right now,
every day they are recording the highest number of cases. There was a time I started monitoring it when they were recording 400,000 cases in a single day. And throughout the pandemic since last year, Nigeria has only recorded just about very few, not that much, just a fraction of what they recorded in a day. So the pandemic has hit them disproportionately higher. And our vaccine supply in Africa is coming from a facility in India, I think the Serum Institute of India. And if you look at the population of India now, it's even more than 10 times that of Nigeria. So they decided that instead of exporting these vaccines to other countries of the world, they have their own peculiar problem, that they are buying up all the vaccines that they are producing locally. And we have to always understand the fact that Africa is in the position that we are in, and other lower medium income earning countries are in the position that they are in, because we did not prioritize developing our vaccine manufacturing ecosystem. In Africa, only a few countries have the capability to manufacture COVID-19, and only one facility in Africa, the Aspen facility that is in South Africa, that has been contracted to start local production of the Pfizer vaccine. And this is expected to take, we will start seeing those ones being locally produced towards the third quarter of the year, and that is expected to still improve vaccine access in Africa. So back to your question, the problem that Africa is facing, the WHO cannot say that, okay, because you are producing something in your country, don't use everything up, share with the rest of the world. And countries that are buying up more than 4 times what they need, let's also understand the fact that nobody knows what is going to happen tomorrow. There will always be need, maybe people traveling into their countries that needs to be vaccinated at the point of entry. And of course, they've already signed these deals to really guarantee the vaccine manufacturer so that they can actually sell it. And also another point I would like to make is the fact that all these vaccines are now, some more rich countries are now looking at how they can help developing countries with sharing. Just last week, I think the United States government committed to sharing 80 million doses of vaccine with the rest of the world out of the excess that they had. Countries like France has also shared some doses with countries like Mauritania. So what they just need to do, just do everything and start sharing.
Even though they are getting surplus, they are also making efforts to make it go around. But you mentioned South Africa's willingness to produce by the third quarter of this year. We'll still come back to where this places Africa in the scheme of things, in world politics, in global conversation. Because by the time Africa is getting ready to produce in the third quarter of 2021, that means the rest of the world has moved on.
Oh, yes.
You know, most of them are even vaccinated, their citizens and things like that. But we'll come back to that. Now, my interest would be that at some point there was a back and forth between South Africa and one other country or a vaccine manufacturing company about how they're unwilling to release the formula for producing the vaccine, and there were allegations and counter allegations and things like that. How does that ecosystem work? Is it that we're not entitled to be able to say that, okay, there's a global pandemic, we have been able to act this, then let us pass on the recipe to you to produce, and things like that.
Yeah, yes. You're talking about the politics that goes on in the World Trade Organization. Okay, we have to understand the fact that because we've not had equal access to these vaccines, we should not neglect the business side of those things. For instance, the patent regulation is if I developed something that I invested money, lots of money into the research for the emergence of that product, I have every right to hold on to that patent and maximize the revenue that would accrue to me from the sale of that product, so that I can recoup my investment back from that product that I've developed. But in the context of a global pandemic, I really followed that debate. Two countries, South Africa and India, were the ones that were driving the WTO to compel countries and companies that have this patent to release it, because we're in a global pandemic. But we can still see that even though South Africa and India were the ones driving for these patents to be released, when India now saw a serious pandemic in his own country, it also started his own nationalistic tendency that, okay, do you feel, because the Oxford AstraZeneca vaccine researchers actually released this patent, they had an agreement with the Serum Institute of India to be the ones producing these vaccines for other parts of the world. So when India now saw that it also had the pandemic on its hand, it now decided that, okay, we are not even, we too, we are not sharing. So every country still has its own nationalistic tendencies. And what was put forward, the suggestion that the European Union, in which, for instance, Oxford AstraZeneca vaccine innovation was from Europe, so they had some control over its own patent. So what they put forward instead was that instead of talking about patent release, why not let us mass produce these vaccines, so that at least we know it is still the right still belongs to us, but we are still being able to mass produce it and share with the rest of the world. So that is an approach that they are putting forward. But we are really happy that United States government under President Joe Biden now several weeks ago said the country is also committed to patent sharing, and we are going to see how that plays out.
Pans out, right? Yes. Okay, but doesn't this bring the question of people looking to recoup investments, people looking to make money, people looking to hold on, take monopoly of a certain sector, even within a global pandemic when people are dying? But
if there is no return on investment, people will not be motivated to do the researches that would save lives. For instance, we have some diseases. We have Ebola, we have Lassa fever. Till today, they are just starting a clinical trial for Lassa fever, a disease that we've been suffering from for more than 70 years. And the reason is that it's affecting just a few people, just a few countries. So there is no, the international research community or the international pharmaceutical ecosystem may not see the need to invest billions of dollars in clinical trials that will result in that. And we are having a situation that is affecting the rest of the world. So there is always that need to ensure that even though we are trying to save more lives, we are still ensuring that the pharmaceutical ecosystem, the researchers are still able to develop things. For instance, they did not stop us from developing our own local vaccines. If Nigeria is able to build an entire ecosystem, that there are researchers that are coming up with the formulas, that are coming up with vaccine candidates, that we did our own clinical trials, we developed our own vaccines. Nobody will tell us what to do. Russia did it by massively investing in their own vaccine research ecosystem. China did it, and they satisfied their own local market needs. And that is what Africa needs to do. And I'm happy that the key...
Africa needs to look inwards now,
yes,
as we speak. Okay, I would like us to break this down, because even though both of us can understand a lot of this professional jargons, many people need to be able to relate and say that if vaccine inequality is not addressed, this is how it affects me in the larger scheme of things, as a trader, as a family person, as a professional in one space or the other. How does vaccine inequality affect every African you see out there on the streets?
Yeah, that's a very good question. And the way I'm going to take it is this. If you want to follow the due process of public health, we will not ideally be able to open up all the schools, the way we are supposed to open them up. And for instance, let me give you a good example. Let's say a university that, students do stay in dormitories, in hostels on campus. And so when everybody is not well vaccinated, whenever we don't have vaccines to go around, schools will not be able to go back to normal, which means that students will not be able to reside in hostels because they will be in an enclamped place where they can easily share the virus. And what does that happen? How does that affect individual traders? The person that sells rice, the person that sells groundnut, the woman that sells airtime in the premises of this hostel, their individual businesses will be affected. They will not be able, because since everybody will still be saying that let's keep social distance, students should be coming from home instead from living. Every trader that supports that entire ecosystem will be affected. And look at every other line of businesses too. And that is the reason why African countries, many of them know that if we are saying that we should follow the due process how it's supposed to be, maintaining social distance, masking, look at when there were lockdowns, individuals that were running businesses, look at party event organizers, concert, event center managers, those businesses were really, really affected.
And if we're not vaccinated, there's still that risk
exactly
of another viral infection, and like India is currently experiencing, right?
Yes, we are sitting on a potential keg of that keg that can explode anytime. Yes. So that is the problem that we are dealing with. And I think on Thursday, the African CDC DG held a press briefing, and he said that eventually the strain in India has already been identified in several African countries, and it can really, really go around. And the problem is this: does Africa have the capability to withstand another lockdown, another vast infection that they are having? And when that happens, our healthcare system can easily be overwhelmed. Very limited oxygen supplies can actually make the wards of hospitals to be shut down. And when we don't do, but what does a vaccine, what is the major function of the vaccine? The major function of the vaccine is not to prevent infection, but to ensure that even if you are infected, you are not down with the disease, you don't have severe disease, or you don't die from the infection, from the disease. So that is something. And until we are able to give as many citizens that guarantee that even if you get infected, it does not do you, there is no major harm that it does to you, we cannot confidently say that let's start living our lives normally.
Okay. Very soon, most of those countries that we call rich countries will be done with vaccination. They would have moved on to the next thing on their agenda. Where does that leave Africa?
Where we've always been. Lagging behind the last. Everybody will now say that since we vaccinated ourselves, let's start supporting African countries.
Let's donate.
Fund. Yes, but one, as bad as the COVID-19 pandemic has been, what is happening is not unique. It's not peculiar to Africa. It's not peculiar to the COVID-19 pandemic alone. It has actually been a systemic problem. During I think late last year, I was talking to somebody that heads U.S. Pharmacopoeia, the medical organization in US, and he said something that in spite of the COVID-19, there has actually been progress. Before, from the point of development of a new drug, its availability, and to the time it's available in Africa, it used to take years, sometimes decades. Look at hepatitis B vaccine. Before it was discovered, it was licensed in the US and several developing countries more than 15 years before it eventually became available in Africa. But we are looking at the COVID-19 vaccine that was just approved late last year, and already by March. Available. So we are seeing progress, but it's not something that is peculiar to us. And that is why stakeholders in Africa should now use this COVID-19 pandemic as an opportunity to re-strategize.
I know that you mentioned there's a need for Africa to look inward.
Oh, yes.
And that will be my final question as we round up this conversation. How can Africa look inward, considering all the current challenges that we deal with? Especially Nigeria, who is at the forefront, is one of the leading countries in Africa.
Nigeria, the leading countries in Africa.
One of, I did not say the leading countries, one
because
of the leading countries in Africa.
When, if you look at the breakdown of countries that there is potential for vaccine production, Nigeria is not there. We are talking about countries in North Africa, we are talking about South Africa, and we're already seeing South Africa signing deals, taking the lead. And so what we need to do is that we should stop relying on the rest of the world. For instance, I saw a shocking analysis data that showed that out of all the vaccine doses that Africa is receiving, we do measles vaccine, all those diseases, polio. Africa is only producing less than 4% of its vaccines. 96% of the vaccines that are administered annually in Africa comes from from foreign countries. And we have some facilities across Africa, like the facility, a research institute in Senegal, that is capable of producing some yellow fever vaccines. So what needs to happen is this. In the short term, deals like patent sharing is really going to be effective for those, so that institutions that have the capability to produce vaccines in various African countries can quickly step in and continue to close the gap. While in terms of research too, Africa needs to also massively invest in research, and so that vaccine candidates can easily be identified and processed. And above all, Africa also needs to start believing more in science. And it was only in Africa that a president will say that we've prayed away COVID-19 in our country. When an entire country is acting based on this recommendation, then the end for that disease in that country will be very, very difficult. It has something that has been consistently happening with diseases. Look at HIV. Even though HIV started from abroad, they've been able to put it under check over there, and it's now an African problem. The leading country with the highest case of HIV in the world is an African country, followed by Nigeria. And we also need to understand the fact that where a disease originated from is not a problem, because we are living in a highly connected world. But what you do when the disease has landed in your country is what really, really matters most.
All right, thank you so much for being a guest on development issues. It's quite an exhausting conversation because of the implications, and when you also consider the prospects for solution. But we do hope that there is light at the end of the tunnel.
Hopefully,
right?
yes.
Okay, it's a Nigerian thing to always hope. And it's on that note that development issues comes to an end for this episode. My guest on the program has been Mr. Paul Adepoju. He is the community manager for the International Center for Journalists Global Health Reporting Crisis Forum. And I do say that you join us again for yet another episode next time, as we also discuss about the economic implications of the inequality of access to the COVID-19 vaccine. The name is Zainab Sanni, and I'll see you next time.